Okay, so good morning, good afternoon, and good evening to the members of the Pasteur Network community, wherever you're joining us from. We have many people from the whole network, and we are really happy to have you with us. Welcome to this new edition of the Pasteur Network monthly seminar. I am Hisham, your host and coordinator of these sessions. As usual, we'll start with our speakers' presentation, followed by a Q&A. Feel free to pop your questions in the chat or during the Q&A. Of course, free heads up, to keep things run smoothly, we kindly ask you to turn off your microphone and your camera during the talk. The seminar is recorded and will be available soon on our Pasteur Network YouTube channel, so you can have it and you can share it with your colleagues if you want to. Today's topic is India Health Fund accelerating innovation to combat infectious diseases. And for that, we are really happy to have with us Mr. Raghavendra Rao, Director of Portfolio at India Health Fund. Raghav leads investment support to innovative health technology startups working within infectious diseases. He is the head of a team of public health experts who understand the key need gaps within infectious diseases, human AMR, and the impact of climate change on health to identify potential solutions based in technology. His team helps innovators navigate product development with funding, technical guidance, and strategic partnerships within the public health ecosystem. With about 17 years of experience across business consulting, deep science healthcare startups, and the nonprofit sector, Raghav has worked with firms like Capgemini and Data Monitor. He has experience with deep science startups from US and UK across critical care, acoustic cardiography, cancer diagnostics, leading India market entry, strategy development, user research, and product development. I will give the floor to Raghav in a few minutes, but before, the CEO of India Health Fund would like to give some words. So please, Mr. Madhav Joshi, the floor is yours.
Thank you, Hisham. Thank you, everybody, for joining this session today. It's our honor and privilege to be sharing a little bit about India Health Fund with you. So while Raghav will talk a lot more about India Health Fund, I just wanted to give you a little bit of context about who we are and why we exist. So for those of you who may not be familiar with India, the Tata Group is India's oldest and largest business group. And today it's a $150 billion business group that works in areas from salt to software to aerospace and now semiconductors. And it's India's oldest and most respected business group. 150 years ago, when the group was set up, the founders of the group took the view that the benefits of business should go back to the communities business served. So the ownership of the group was vested with a foundation called Tata Trusts. And Tata Trusts have been using the dividend income from the Tata Group, which is now a $150 billion group, for development work across a number of areas in India. But the primary focus have been on education, on health, on livelihoods, sanitation, as well as sustainability. The Tata Trusts have had a long history of institution building in India. And some of India's oldest and largest institutions were set up by Tata Trusts, including, for those of you who are aware, the Indian Institute of Science, as well as the Tata Memorial Cancer Network of hospitals, among others. The trusts also have a very long history of running programs for healthcare across a number of areas all over India. And I wanted to give you that context because that's what led to India Health Fund. When the Sustainable Development Goals were announced, Tata Trust took the view that achieving the elimination goals for infectious diseases, which were one of the sub-goals in the Sustainable Development Goals, would be very challenging relying only on programmatic approaches. And that was particularly true for India and many other developing countries, where there was a significant gap between the existing incidents and the incidents that was needed to be considered suitable for elimination. And that's where science and technology was identified as a potential disruptor, which will improve the ability of programs to get the discontinuity that was needed to come closer to innovation. But the related hypothesis that Tata Trusts had was that market failure had prevented the development of meaningful science and technology-based innovation for infectious disease, which is very different from what was happening with non-communicable diseases. So whether it was cancer, cardiology, diabetes, or anything else. And the reasons were quite obvious. These were diseases of the poor, which largely in developing countries. So there wasn't enough return for the pharmaceutical or the health tech industries to make the investments for the returns they expected. And it was really to break this that Tata Trust conceived India Health Fund as a catalytic fund, which would not just provide the patient capital that was needed to support innovation and development, but also help overcome the so-called valley of death, where a meaningful prototype doesn't get financial support, but also then the funding to scale. So that's just a little bit about our origins and our background. I'll now hand this over to Raghav to give you better understanding of who we are and what we do. Thank you for your attention.
Thank you very much, Madhav.
Thank you so
Hisham,
much.
I'm just
please. The floor is yours.
Putting this on full screen, so let me know if that's okay. And
yeah, perfect. Thanks a lot.
Do you want me to switch the camera, Hisham?
Yeah, it would be great.
Okay, I'll do
and
that.
Please, everyone, can you just turn off your cameras and microphone? Thanks a lot. Oh, go ahead.
Okay. Yeah, I think I've done that. So yeah, let me get started. Sorry, give me a second.
So maybe while Raghav is setting that up, I think it's also worth mentioning that we are the only organization of its kind where funding from the private sector is being used to enable innovation development for public health. And our focus is on enabling solutions from the global south for the global south with financing for the global south.
Thank you for this precision. And we have, as you know, and you might, we will discover it during the Q&A session. We have many institutions from the global south in the Pasteur network, and some of them are in Southeast Asia. So, yeah.
Absolutely. So, and we've had the privilege of knowing the Pasteur network for a while, so it's wonderful that we're having this opportunity to share a little bit today.
Yes.
Yeah, thanks a lot.
I hope you're able to look at view my slides.
Yeah, you go ahead. We can see your screen.
Okay. All right. Okay. So just to follow up on what Madhav just shared, as Madhav is suggesting, this was set up. Sorry. I hope you're able to see the screen all right. I mean, there's some disturbance that was showing on the team side. I hope the screen is visible to all of you.
Sorry, could you repeat?
I hope the screen is clear. The slides are clearly visible to you.
Yeah, perfect.
All right, good. Okay. So like Madhav was suggesting, this was set up and conceived by the Tata Trust, who is India's oldest philanthropic foundation. And this was set up as a shared thought exercise between the Tata Trust and the Global Fund. And as an entity, we look at providing finance at the value of death to innovations that we see are fit for purpose within the infectious diseases domain. And I lead the team that identifies the key problem statements from the ground that are relevant at the primary health system level. And we then identify these solutions, fund them, provide them the connections with the ecosystem across public health to help them accelerate the journey from development to validation to actually being used within the public health system. Our vision is that we are enabling innovations for a healthier world at large, and we do this by strengthening health systems, by improving access to healthcare. We, like I was already saying, we help innovations accelerate their journey from development to validation to actually being used in the health system, both public and private. We also build significant partnerships across the ecosystem within public health, both in India and elsewhere. So partners like the Indian Council for Medical Research, the Central TB Division, the National Vector Control Board in India, partners like UNITAID, the WHO, the Stop TB Partnership, the Malaria No More, etc. across the globe is our partners. We work very closely to make sure the support that we're offering is done in the right way. While we are set up as an independent fund, we also were set up as a catalyst. The idea is to amplify and bring in more funds and greater support to aggregate and amplify the support that we provide to these innovations. This is our theory of change. So if you look at the leftmost part of the slide, that is the value chain. That is the sort of theory change that we want to identify. We start by identifying technologies that are at the technology readiness level 5 or 6, where there is a ready prototype that is developed and there is a limited amount of data that is available at the laboratory level. And then we pick these innovations and offer them grant capital-based financing. We also support them for product development and validation, both at the laboratory level and the community level. And we also then provide them the necessary technical guidance to help them develop these products better and provide them the funding for generating the relevant evidence. So just to break and give you a tangible example, after my team does the initial research to identify the need gaps of the on the ground, for example, let's say within tuberculosis, we then develop this larger list of problem statements within primary health. Then we share these problem statements with key clinical experts, laboratory level experts, technical experts across the country and elsewhere. With the organizations that I've suggested before, Stop TB Partnership, the Central TB Division, end users within the state and central health systems, even in India, the state of Maharashtra, where we reside, and other similar public health systems, because health is a state subject in India. What these experts would then provide us are pointers to say that these problem statements are relevant. Are they addressing a key need gap, or are we supporting the wrong solution? So that level of validation is passed through, and then the finalized set of problem statements are then what we take up to announce calls for innovations either by ourselves or in partnership with other similar organizations. I'll give you examples of the current active calls as we proceed along. But through these calls, then we receive suitable solutions or technology-based solutions, both medical devices, diagnostics, and digital health-based solutions that solve for these problem statements. We then take them through a technical evaluation, which comprises of experts across the organizations that I was mentioning, followed by a commercial due diligence exercise and an evaluation, which also tests these solutions to be fit for purpose, not just for developing what we want them to, but also from a sustainability perspective in the long term. So that's how we go about identifying and selecting and supporting these innovations. We do leverage collaboration within the public health ecosystem across the value chain. At incubation, we work with a number of technology-based health science incubators across the country. We work in the mid stage, we work with other philanthropies such as ourselves to bring in amplified funding, co-funding for innovations which need a larger support beyond the means that we support them with. We also bring in technical mentorship, both from the industry and key key science-based institutes in the country, like the Indian Institute of Science, several science-based incubators, key industry players who already progressed and have developed significant expertise in the regulatory, in the manufacturing space, so that they actually help these younger startups who have great ideas, but sometimes have trouble translating that product into a meaningful usable health technology, and also in terms of understanding the market entry aspects, the commercialization aspects, which are very important for them to have an accelerated pathway towards use in the health system. And as I said before, we also uh, try as much to get amplified pooled funding to see where our support ends. There is larger implementation support, also support for translation, market access from other industry players, from equity investors, from larger philanthropic foundations which can support usage of these solutions at scale, and not to forget the public health system itself, because they would be the ultimate adopters and users of these technologies. So we work very closely with the Indian Council for Medical Research to look at multi-centric validation of the technologies that we've supported till that stage, so that then these can then be recommended to the respective health systems across the state and the central level to be used, going forward. The outcomes that we seek are improved accuracy, improved accessibility, especially in the hard to reach regions at the primary care. And we focus very much on vulnerable communities. We focus very much on the peripheries of healthcare. And all of our solutions would bring definite improvement in the accuracy, the sensitivity, the specificity that these technologies, if it's detection tools, an improvement in efficiency, if they're tools that are used within the continuum of care, supply chain, etc. And the larger objective that we have through the efforts that we've been playing over the last 7 years now is to reduce preventable deaths from infectious diseases in the long term. And we do this by increasing the number of patients that could be diagnosed, by using easy to use technologies that actually would reduce the dependency on infrastructure, increase in the number of patients treated, thereby leading to reduction in the number of deaths, the mortality that occurs, which is significant even now within infectious diseases in the country. As we've progressed over the last 7 years, we've sort of zeroed in on 3 key focus areas. First one being screening and diagnostics. So we look at minimally invasive and non-invasive tools for tuberculosis, vector-borne diseases, and now increasingly within the human antimicrobial resistance space. We also look at new age surveillance tools and data-driven technologies that would improve the existing largely manually driven surveillance response to climate sensitive diseases. For example, vector-borne diseases in the country is still largely done manually by entomologists that are employed across the country, and this takes significant effort and man-hours. We try and reduce this effort and also improve the efficiency by bringing in and leveraging technologies that such as machine learning, Internet of Things, and larger digital data systems that could actually improve the surveillance and also inform the health system in real time. While we look at the disease continuum of care, both within infectious diseases and other areas like antimicrobial resistance that we cover, we also look to support system strengthening tools, both from digital health and also in also medical devices, which could optimize the supply chain so that the treatment to patients, the connectivity when it comes to supply of drugs, the connectivity when it comes to transport of samples, all of this is optimized within the country. So we also do support anything that brings in efficiency within the continuum of care beyond screening, diagnostics, and surveillance. Our disease areas of focus currently are tuberculosis, vector-borne diseases, human AMR, and increasingly now climate-sensitive infectious diseases. And looking at the impact of climate change, since we already support a number of TB solutions, these also are relevant in the lung health space, and they've already proven tools that can be used to identify lung health abnormalities, which is why we've also included lung health in the current scope of things, diseases that we support. The emerging areas for us within the disease space, one is anemia, which we are soon going to take up on board, looking at minimally invasive diagnostics and non-invasive diagnostics to cover the large burden of anemia in the country, to detect patients early, and to increase the access of detection and diagnostics to populations that so far have not been reached in the country. And this is a problem that's been impeding India for decades now, and we'd like to play our part in solving for that. We are also working with other philanthropic partners to develop our support area within the maternal and child health space. All of this has come through our experience in within working within infectious diseases, the approach that we have developed in terms of how we identify need gaps and then how we support these solutions and make sure we take them to the last mile. Using this approach, using the experience of working with various stakeholders in the ecosystem, we also want to enter these newer disease areas to offer similar support so that we could also provide an end-to-end support even in these new but high burden disease areas. The outcomes that we seek, like I already talked about, uh, we looking at early diagnosis and improved access to primary care. We're looking at reducing infection transmission. Uh, we have a huge skill gap within health workers and the availability of clinicians in the country. We aim to bridge that gap through the use of technologies and through capacity building of these health workers and clinicians through the efforts that we do. With all of the solutions that we support, we aim to ensure scalability for these solutions. We want this not just to be used in a few geographies, but to be used and adopted by the health systems across. This is the approach that I was talking about. We start with identification and prioritization of the problem statements on the ground. We then use this ratified list of problem statements to go out there, put out RFPs by ourselves or with partners. And we also have a pipeline of solutions that some of our partners do suggest to us. We find these innovations and fund them through the evaluation exercises that I've talked about. Then we have a dedicated team of public health experts who work very closely with these innovators to manage these portfolios for the projects that we're funding them for, to make sure that this is done in time. And we also parallelly work with other ecosystem partners to get additional funding for these innovations. We also make sure we get technical mentoring for these innovations. We get regulatory know-how, manufacturing know-how to enable acceleration with the development that these innovations are making. We also enable through the partnerships, market acts, ways to find better market entry strategies, improve market access both within the country, and because many of these innovations are also relevant in LMICs elsewhere, we also enable this transfer through the partnerships that we work with. And we have a dedicated partnerships team who leads these efforts. And for all of the impact that these innovations are making, it is we understand the importance of sharing this knowledge. A seminar like this is one of those examples where we also use these opportunities to share the progress made by these innovations to see and find relevance for them elsewhere. And we also amplify and try to get in greater resources by other partners apart from us to help them in this journey. This is a quick overview of our portfolio. So we range from surveillance to screening, diagnostics, disease adherence to looking at efficiencies within the supply chain as well. So our portfolio combines both diagnostic tools, digital health tools, and even some medical devices that work across climate and health. For example, we have Cure.ai, which is a machine learning based tool that uses digital chest x-rays and analog chest x-rays, and then applies the machine learning algorithm that they've developed and validated across 4 million chest x-rays right now to identify lung health abnormalities. We funded them to develop and validate and deploy the solution for tuberculosis. And this is now being deployed over 40 countries across the globe. And this is a complete lung health solution suite, so they can detect COPD, asthma, lung cancer, early stages of congestive heart failure, etc. Another similar tool that we've recently onboarded is called SALSIT. It is a cuff sound based lung health assessment tool. The patient records their simulated cuff sound on their mobile phones, And then the machine learning algorithm that the company has developed uses audiometric analysis to identify potential lung health risks, including tuberculosis. They're currently being validated by the AIMS in Delhi and other locations in the country to find the relevant data across 6,000 patients to see how this can be used as a triage tool, because it does not even need the chest X-ray to detect or triage a patient for tuberculosis. We also have some interesting solutions in the climate and health space. Our latest investment is an organization called Khushi Baby, which has developed a climate health vulnerability index to do it is an early warning system that identifies potential disease risks from the various climate stressors in the state of Rajasthan. And then they use these real-time inputs to work closely with the health system. I'll talk about that in detail in my later slides, but this is we support over about 15 odd innovations through our journey so far, and we're very selective in terms of selecting which innovations we support for, because we want to make sure that these are relevant at the periphery, at the primary care, can be used by a minimally trained health worker uh, or even an ASHA worker, and then can be used at the patient's doorstep and are actually cost effective. So these are very strict criteria that we apply when we select these innovations for our support. I'll give you an example of how our support has actually helped catalyze the investment that we've made. The first example I'm going to give you is a solution called Mosquito. It's developed by a company called Track It Now. It uses machine learning and IoT. Basically, the wing beat frequencies of the mosquitoes differ based on the species. That is the primary principle on which this technology has been developed. Now, Mosquito has a trap-like device that is set up within a community that has an attractant layered within the trap. And as mosquitoes enter this trap, the sensors that are placed inside the trap capture the wing beat frequencies of various species of mosquitoes. And based on identification of the species of mosquito, the potential disease that this vector carries can be identified, and this information can be relayed in real time to the infection control authorities in the district and the state where it is actually deployed, so that they could do a measured infection control process instead of the spray and pray mechanism that they currently deploy. So we've supported the development of the database of wing beat frequencies of 10 different disease transmitting vector species. We've also helped them improve the algorithm accuracy with internal development, and we funded them to deploy these 5 devices across different regions to capture this data to actually develop and improve the algorithm accuracy. So right now, this algorithm is fully validated for 9 of these 10 species, and currently we are supporting the public deployment of this solution at the Mumbai Municipal Corporation within Mumbai. It is again one of the cities with the largest vector control program in the country. And we are deploying this across select blocks within the district to actually find real world evidence and real world impact of the solution in terms of how it can bring in efficiencies to infection control within the district's program. We are also deploying this at ICMR related research center in Bhubaneswar, which is the eastern side of the country, to understand the scientific impact, basically the evidence more from a clinical perspective in terms of how this solution can fit in the surveillance continuum of care within vector-borne diseases. The larger objective with a technology like this, given the increasing importance of climate resilience and how we identify climate sensitive diseases and how we can look at surveillance from an integrated perspective, this is a solution that we see can fit in very well with some of the programmatic approaches that are being done for vector surveillance, programmatic approaches that are being done for early warning systems, and we can use real-time tools like this to see how this can be further optimized and better efficiency in terms of infection control. The second example that I can talk about is the Climate Health Vulnerability Index from our latest investment, which is Khushi Baby. Now, Khushi Baby is a digital community health integrated platform that's been developed and deployed across over 8 to 9 years now in the state of Rajasthan. So all of public health indicators and social demographic data and village level health data is being captured by the community health integrated platform tool, which is basically a mobile app that an ASHA worker has. And when they go to collect this health data from door to door across various diseases, both TB, vector-borne diseases, the state of Rajasthan uses Khushi Baby's climate health integrated platform as their digital arm. So we have a solid background and a base data aggregated at the village level for community health across these diseases. Now, what we are trying to fund here is the development of something called the Climate Health Vulnerability Index. So this would, on the layer of the village level public health data, add climate stressor data from exposure to temperature, air quality, uh, looking at precipitation, looking at vulnerability to droughts, vulnerability to floods, etc. All of this data that comes from the Google Sentinel data, the Internal Meteorological Department, etc., is what we call as the exposure data. This would then be combined with sensitivity data from the current health status at the village level, the various demographics in terms of socioeconomic status, in terms of the paying capacity of the individual patients there. And lastly, the adaptive capacity, which is about the existing status of the healthcare systems, the healthcare infrastructure in these districts. So the Climate Health Vulnerability Index would take all of this data and develop a predictive platform that would identify risks. For example, what is the risk that is associated with heat waves and the related effect it could have on pregnancy outcomes in vulnerable geographies. The associated climate stressor from precipitation data, from temperature vulnerability, and the effect it could have on the transmission of vector-borne diseases. So these are the kind of impacts that we're trying to measure. And this is a solution that is being co-developed with the public health system of the state of Rajasthan. So we actually have already de-risked the potential adoption of this technology. And this is something that we are supporting both the development, the validation, and the deployment at scale across the state of Rajasthan. We've already got indication of interest from other partners that once this is scaled across the state of Rajasthan, this would further then be supported to be deployed in 2 other states in the country, Karnataka and Maharashtra. And we've received funding interest from other partners that we work with. So this is a solution that we'd like to see to be used scale so that we could not just identify early warnings, use this as an early warning system to identify potential risks, but also help the local health system proactively deploy their programmatic approaches and innovative solutions to actually be used in the ground. So in this light, we actually have launched a call for innovations. This is done in partnership with the Asia Venture Philanthropy Network. And the Asia Venture Philanthropy Network, as you know, works, supports innovations and supports community health organizations, non-profit organizations across the region of Asia. We are doing this in partnership with foundations like the Bayer Foundation, the Prudence Foundation. And this is focused on 2 key thematic areas. One is the detection, surveillance, and management of climate-sensitive infectious diseases. So we are looking at diagnostic tools, medical device-based diagnostic tools. We're looking at digital health surveillance that can identify climate-sensitive infectious diseases, the risk they possess, and how these tools can then be used to manage this. So we're open for innovations both from the startup world and the non-profit world. And the second thematic area through this call would be solutions to reduce heat stress and innovations that can actually be heat stable, heat climate resilient innovations, both in the medical device, the physical form, and the digital solutions as well. This is a call that is open till the end of this month and early May. We are looking for solutions that could combine both programmatic approaches with technology-based innovations to solve for this. And this is probably the first of its kind where we're looking for on-ground evidence to come up. While there is a lot of discussion about the intersection of climate and health, we also would like to see ready solutions that could be used on the ground and evidence be gathered so that we could actually use this information and then use these models to further scale this up across other geographies. The next innovations that I would like to talk to you about are the tuberculosis innovations that we funded. Cure is an example that I've previously stated to you. We've funded, and this is the only software in the country that is capable of being used across both analog and digital chest X-rays. We funded this to be validated and deployed across 100,000 scans in the country, both in primary health settings, in facility-based settings. So they have the largest database when it comes to training data for chest X-rays and the use of AI. While our support was then further amplified by funding from other agencies like the Clinton Health Access Initiative, the Central TB Division has actually also worked closely with them to see how the solution can then be adopted within the public health system in India. The Stop TB partnership has also funded Cure AI to be used in screening facilities in the district of Mumbai. So this is a solution that's as an example of catalytic investment from us, where we funded the initial development, the validation of the algorithm, and usage in minimal settings to start with across a variety of settings. And then following that, this has now received support from other philanthropic foundations, venture capital investors to scale up not just in India, but over 40 countries across the country, across the world. And it's a lung health solution suite, like I said, and they're now looking to even expand to other areas such as cervical cancer and stroke-based solutions. So this is an approach we'd like to take with all of our portfolio. While our support would remain in the infectious diseases domain, we expect the solution, and we encourage them to be a platform solution which can cater to a number of other disease areas. The next solution I'd like to talk to you about is called Stellar Diagnostics. This is started from the research. Again, a great example of research translating into a tangible health technology or a medical device for use within the public health system. This started off in the New York University, where a scientist called Dr. Suman Lal was developing a blood-based tuberculosis triage test for patients having tuberculosis and HIV. And we believed, when we've interacted with the scientists, we believed that this solution, this technology that was developed as a research aim at the New York University can actually be leveraged to develop a point-of-care triage test for tuberculosis. And this is the world's first TB triage test using blood as a sample. We funded the development of the test, and we've also funded the validation of this test at a laboratory level. Right now, it is showing accuracy of over 85% to be used as a TB triage test. This has already received funding from the Indian Council for Medical Research to be supported for multi-centric validation across 3 centers in the country. Once they complete that multi-centric validation, this will be a test that can be adopted by the Central TB Division for the National TB Program to be used as a triage tool. This would reduce the dependence on infrastructure such as the X-ray facilities or even infrastructure that is needed for traditional diagnostics like the PCR, the RT-PCR solutions, or other molecular diagnostics. This can again be used at the primary health level because all it needs is a blood prick as a sample. We are again trying to talk about this not just for use in India, but also in other LMICs with similar screening burdens, because this is a solution that can be used at the primary care. An example again of catalytic investment where solid research from a scientific institute like the New York University has actually translated through our funding support and our enablement of ecosystem support through other partnerships to our technology that is now getting ready to be used within the public health system. As I was talking about the other active call, this is also an open RFP that we've launched, and this is also open till the end of April. We're looking at two thematic areas. One, over the last 8 years, we've supported several innovations within TB, and we have some of them right now at a very mature stage where they're being used on the ground. But we also have gaps that are not filled to meet the TB elimination goals, where we could strengthen the TB continuum of care still. We could look at innovative implementation models that combine different technologies to actually improve the efficiency of how TB care is delivered. So we are open to we are open to solutions, both implementation approaches and newer diagnostic tools, newer detection tools, newer disease adherence tools that can strengthen the existing TB continuum of care as is in the country. Secondly, while a lot of focus has been on active case finding for pulmonary TB, there are a lot of unaddressed areas within TB like subclinical TB, pediatric TB, and also focus on non-sputum based samples. So we are opening this RFP for other cutting edge innovations that could bring in innovation that address the unmet needs of TB. We are also doing this with other philanthropic partners within the country to support Indian domestic philanthropy for Indian developed innovations that could be used not just in India, but also other LMICs and geographies with similar burdens. Right now, we are looking to enter into new areas. One is the human antimicrobial resistance space, which is looking at while we've understood the larger impact of antimicrobial resistance overall, we are looking at human AMR to start with. So our objectives are to strengthen primary health systems to tackle the challenges posed by AMR. And secondly, to also enable the local governments and the local public health systems to enhance their decision-making capabilities given the significant burden and the challenge posed by AMR. So we're looking at within diseases, we're looking at neonatal sepsis, urinary tract infections, acute respiratory tract infections, enteric diseases, fungal infections. We're looking at both diagnostics, surveillance tools, and also clinical decision support tools emerging from digital health in this space. The other newer area that we are looking to enter, as I was talking about some time back, is anemia, where we're looking to support both minimally invasive diagnostics and non-invasive diagnostics such as digital tools, so that these could be used in a complementary manner to actually improve the continuum of care within anemia, to improve both detection at the larger levels within public health, unaddressed, hard to reach areas, and also improve the the burden to reduce the burden overall, to enable patients to reach treatment faster through this support. So we are doing this with partners such as the Children Investment Fund based in the UK, who actually have a large program in the country for maternal and childcare. So we will be working in a very similar format, like how we've been doing with infectious diseases, to work across the ecosystem to combine various partners and build this program together as well. So these are about our disease areas and how we work across. This is a snapshot of our partnerships, like I was talking about, right from innovation scouting to incubation support, to create co-funding, to develop strategic collaborations both in the country and elsewhere. We work across various partners that starting from incubators in the country and the biotechnology ministry within the country and the innovation arm of the biotechnology ministry called BIRAC, where we've entered into a long-term arrangement of funding over the next 5 years to co-fund infectious diseases both across early, mid, and late stage. across diagnostics, digital health, and we're looking at infectious diseases, the impact of climate change on health, and we're also looking at antimicrobial resistance through this partnership. We also work with local philanthropies to co-fund some of the innovations that we support. We also work with implementation agencies because it is very important that the innovation we support for development and validation is actually implemented on the ground to generate the relevant evidence and to see how the district and the state health systems can actually adopt these solutions. Hisham, I just wanted to check on time. I only have one more slide to make.
Yeah, I was about to ask you if you can finish in 5 minutes. Thanks a lot.
Okay, I can do that.
Max.
Yeah. Thank you.
Yeah.
Thank you. Yeah, so we also work across various partners to generate the relevant knowledge that is needed to amplify the support that we provide to these innovations, the impact made by these innovations. So we attend seminars, we attend conferences, we're soon going to be at the World Health Summit's regional summit in Delhi, where we'd like to present some of these, some of the impact that we've made. We constantly often meet with agencies in like the Indian Council for Medical Research, their innovation summit, where all of our TB innovations that we've supported and some of the climate health solutions were actually presented to the larger clinical ecosystem in the country. We also try to bring in market access related mechanisms, both for volume procurement of some of these solutions within other markets, to see how these solutions can be supported with venture funding, how these solutions can be supported for deployment at implementation at scale through larger philanthropic foundation support that can come in. The last slide is more a thought exercise that I'd leave out here. We look at several emerging challenges as we have been offering our support. We look at impact of climate change and health. We look at the rising challenge of antimicrobial resistance. We are focused on access to universal healthcare. And we also, a lot of our solutions also have a deep linkage with digital health and AI. So while all of these solutions exist in the larger realm, this also provides us the opportunities to solve for these solutions, like the ones that I put in between, which is how can we enhance foundational research, not just to be research alone, but also connect this with potential solutions based in data and evidence. How can we promote translation research? How can we actually develop better operational research objectives to see how these pilots that we've supported can actually be replicable, scalable across other geographies. The usage of machine learning and AI and foundational AI, and how those approaches, the outcomes from that research can actually be applied to developing new tools, to identifying and supporting better health detection, disease detection, and even improving the supply chain throughout. So this is where we look to identify both regional and global collaboration for best practice sharing, for building knowledge practices, to also enable the linkage between research and linking good quality research with outcomes that are situated in technologies, products that can be used to benefit the vulnerable populations that we're actually seeking to support. And lastly, but most importantly, we also are looking at collaborative and innovative financing, including both from the philanthropy sector, from the government systems across, and very importantly from the private sector to come into this space, because we are trying here to de-risk the innovation development so that the private sector can then be ready to put in their funds to scale this up elsewhere. So that concludes my talk.